Can skin cancer spread to your eyes? Have you ever wondered if skin cancer can affect your eyes? The answer is yes, but it's not very common. Skin cancer, especially melanoma, can spread to the eye, but this happens rarely. Melanoma starts in melanocytes, which are the cells that produce pigment in your skin and can also be found in your eyes. While melanoma usually begins in the skin, it can travel to the eye or, in some cases, start in the eye itself. Let's break this down into two main parts. First, we have melanoma that starts in the skin and then spreads to the eye. This is known as metastatic melanoma. When this occurs, melanoma cells can move through the bloodstream and reach the eye. They can be affected in several areas, particularly the uvea, which includes the iris, ciliary body, and choroid. The choroid is the most common site for melanoma in the eye. However, it's important to note that this spread to the eye is less common compared to other areas like the liver or lungs. Now let's talk about primary ocular melanoma. This type of melanoma originates in the eye itself, specifically from melanocytes in the uveal tract. Ocular melanoma is the most common primary eye cancer in adults, but it is still quite rare overall. This type of melanoma can grow and may spread to other parts of the body, especially the liver, through the bloodstream. Symptoms of eye melanoma can vary. Some people may notice changes in the appearance of their eye, like a growing dark spot on the iris. Others might experience vision problems, eye pain, or even bulging of the eye. However, sometimes there are no symptoms at all in the early stages. When it comes to risk factors, excessive sun exposure and having fair skin are linked to skin melanoma. However, the connection between sun exposure and ocular melanoma is less clear. Both types of melanoma can be aggressive. Ocular melanoma, in particular, can metastasize to the liver, which can be life-threatening. Early detection and treatment are crucial for managing the disease and preserving vision. It's also worth noting that melanoma can rarely occur on the conjunctiva, which is the membrane covering the white of the eye, or on the eyelids. These forms tend to be aggressive and can spread as well. In summary, while skin melanoma can spread to the eye, this is not a frequent occurrence. Most eye melanomas start within the eye itself, both conditions requiring prompt medical evaluation and treatment to manage the cancer effectively. Taking care of your skin with sun protection can help reduce the risk of skin melanoma and its potential complications, including the rare spread to the eye. Regular eye exams are also important for early detection of ocular melanoma, especially if any symptoms arise. Always consult with a healthcare professional for personalized advice and information.